Je vous le disais en titre, Tedros
Ghebreyesus became the first African to lead an agency of the United Nations, the WHO. If we roll up our sleeves, we can get there. That is what he said to the applause of the World Health Assembly, which brings together all member states of the organization every year. Tedros is also the first director of the institution who is a non-physician. The CV of the former minister is quite impressive. A graduate of biology and infectious diseases studies, he was Ethiopia's Minister of Health from the year 2005 to 2012 and then Minister of Foreign Affairs until 2016. Tedros has also chaired the Global Fund to fight AIDS, tuberculosis and malaria, institutions in which, according to the WHO, he made record fundings. On 1st July, the 52-year-old Ethiopian will succeed Chinese Margaret Chan, who led the WHO for 10 years.
Well, it should be noted that during her tenure, the World Health Organization's response to the Ebola epidemic in West Africa was criticized for being too slow. The agency was accused of missing key warning signs about the severity of the outbreak that killed more than 11,000 people. Shortly before the vote, Dr. Tedros addressed the World Health Assembly and promised to respond to future emergencies rapidly and effectively. He also promised to stand up for the rights of the poor. His exact words, "All roads should lead to universal health coverage. I will not rest until we have met this." Looking back at his track record as Ethiopia's Minister of Health, he led a comprehensive reform effort of the country's health system, including the expansion of the country's health infrastructure, creating 3,500 health centers and 16,000 health posts.
Throughout the world, and in Africa particular, the news of the election of Tedros has been well received. To discuss this morning, we are joined on phone by Michel Sidibe, the Executive Director of UNAIDS. Mr. Sidibe. Hello, and thank you for speaking to us. For Dr. Tedros, what contributed to his victory, his personality or his program?
I
have known Dr. Tedros for more than 10 years. He is a dynamic leader and an excellent partner. Therefore, he was able to demonstrate that he could help transform public health and that he had field experience that allowed him to make a difference in terms of program implementation, especially when it came to reaching out to the most disadvantaged populations.
Qui lui permettait justement de faire la différence en termes de mise en œuvre des programmes, surtout lorsqu'il s'agit d'aller vers les populations les plus.
He set up a broad program of more than 38,000 public health workers in Ethiopia. And I therefore think that is his personality of the man and his ability to mobilize the people.
Sa capacité de mobiliser les uns les autres. Mais je crois aussi qu'il faut comprendre que ce n'est pas seulement l'Afrique qui a élu.
But I think it's necessary to understand that it is not only Africa that elected Tedros, it is Asia, Europe, and North America. So I'm very proud of the fact that he is Africa. He's an African candidate, but also he is recognized by the rest of the world. Now he speaks of reforms that must be put in place, a process that must be conducted absolutely. I believe wholeheartedly that it is indispensable. There is no doubt if we really want to ensure we can control epidemics that emerge, if we want to make sure that Africa can represent at least a central point in the comprehensive response in the health field, the organization must be reformed.
Un point central de la réponse globale en matière de santé, il faut réformer l'organisation. Aujourd'hui, pour vous donner
Today, to give you a concrete example, we have 25% of the weight of diseases in Africa and only about 3% of health workers.
Des travailleurs de santé, je dis bien les travailleurs de santé au niveau mondial qui se trouvent en Afrique.
I say global health workers who are in Africa are less than 3% of the medicines we consume, which are also produced on this continent. Thus, it is really important that reforms of substance should be conducted to ensure that there is greater equity and that there is redistribution of opportunities to reach the poor. So Tedros will have to lead this task, but I trust him.
Cette tâche importante à mener, mais je lui fais confiance.
Monsieur Sidibe, on va parler maintenant de l'organisation.
What about the organization as it is currently? What will be the priority? I believe we are going to request the Director General to have a more flexible organization. An organization capable of adapting to the health demands of today's population. I believe that to do this, it will be necessary to reduce bureaucracy. So the organization is going to have to adjust closer to populations, and when we see what is happening in the world, especially with emerging epidemics, we must be flexible and respond fast.
Avec les épidémies qui émergent, il faut nécessairement être flexible et répondre rapidement.